Hi, I'm Wenling, an occupational therapist from NUH. In this video, I will be answering some commonly asked questions on how to care for your hand after the Quervain tendon release surgery. Quervain tenosynovitis or Quervain tendinosis is a condition where the tendons on the thumb side of the wrist swell and become inflamed. If you have this condition, you will likely feel pain at the side of the wrist near the base of the thumb. A tendon is a cord of tissue at the end of a muscle that attaches the muscle to the bone. In Quervain tenosynovitis, the tendons that straighten and bring the thumb outwards glide within a tight tunnel when you move your thumb and wrist. Prolonged and/or forceful use of the thumb and wrist may lead to the thickening and swelling of the covering of the tunnel, causing pain when the tendon moves. It usually occurs after increased activity involving the wrist and hand. It begins as an aching sensation and progresses to a point where any movement of the wrist or thumb produces sharp pain at the side of the wrist. That area of the wrist may become swollen at times. This condition is linked to repeated trauma or overuse of the thumb and wrist in activities such as holding the wrist in an awkward position while pinching or peeling. Repeated forceful thumb motions, for example cutting using a scissors or using a stapler, typing on the keyboard. Repeated gripping with the thumb and twisting of the wrist, for example wringing towels, scrubbing surfaces, opening or closing jars. Direct injury to the thumb side of the wrist. When conservative treatment, which involves the wearing of a splint, activity modification, and/or injection of steroids fail to work, your doctor may recommend that you go for the Quervain tendon release surgery. During the Quervain tendon release surgery, your doctor will cut through the sheath through which the tendon glides at the base of your thumb, after which the tendon will be able to glide freely through the tunnel without being squeezed. The procedure is minor and is performed as a day surgery. If required, you may be referred for occupational therapy after your surgery to regain normal function of your hand. After the surgery, your wrist and thumb will be swollen and sore. You will probably experience some numbness or tingling sensation near the cut, and this will usually go away in a few days, but it may take several months. It may take about 6 to 12 weeks for your hand to fully recover, and you will then be able to move your thumb and wrist without pain. When there's swelling, avoid letting your hand hang down as this will cause more swelling. To reduce swelling and discomfort, try to elevate your hand above your heart level when walking around or sitting down. Similarly, when you are sleeping, elevate your hand above your heart level by resting it on a couple of pillows. To manage your pain, take the prescribed pain medications as instructed by your doctor. To protect your wound, your doctor will wrap your wrist in a bulky bandage. You will be scheduled for an appointment to see your doctor to remove both the bandage and stitches after 14 days. Our wound care nurses will advise you on how to take care of the wound. Essentially, the bandage needs to be kept clean and dry at all times. You should go and see a doctor immediately if you have these symptoms: feeling faint and unwell, chest pain or shortness of breath, feelings of nausea, develop a high fever, have bleeding or yellowish discharge from your wound, feel a lot of pain at the wound even after you have taken the pain medication. Your hand feels cool, looks pale, or changes to a bluish-purple color, have tingling, weakness, or numbness sensation, unable to flex or wiggle your fingers, have pain in your leg, which are signs of blood clot in the leg. You may shower after your surgery, but you should cover your bandage with a plastic bag. Secure it with tape to prevent it from being soaked and being infected. Raise your affected arm during your shower. Remember to protect your wound from any injury. Do not swim for at least 2 weeks after the surgery. And if you wish to use the hot tub, do not soak your hand in the hot tub. For the first 2 weeks after surgery, please do not do the following. Lift objects which are heavier than 500 grams. Perform activities that require repeated arm or hand movement such as vacuuming, cleaning the windows, chopping food, typing, using of the mouse, and using power tools. Right after the surgery, you should start to use your thumb and wrist for light daily activities as tolerated, such as feeding, dressing, and grooming. So this will depend on the nature of your work. If you are required to do repeated hand or wrist movements, put pressure on your hand or wrist, or lift heavy things at work, you may need to take 6 to 12 weeks off work. Do discuss this with your doctor or therapist. After your bulky dressing is removed, you can start to do some light exercises as tolerated to minimize internal scarring. Firstly, do some wrist movements. With your elbow supported on the table, make a loose fist with your fingers. Bend your wrist forward and backwards slowly. The next wrist movement will be to move it sideways. Put your palms face down on the table. Bend your hand gently towards the thumb side, then bend it towards the pinky. Lastly, with the elbow bent at 90 degrees, rotate your forearm so that your palm faces up and rotate your forearm so that your palm faces down. Do these 3 wrist movements for 10 repetitions and 3 to 4 times a day. Secondly, do some thumb movements. Rest your arm on the table with your palm facing down. Keep your fingers straight. Bend your thumb outwards and inwards. Next, rest your arm on the table with your palms facing up. Keep your fingers straight. Touch the thumb to each fingertip, one finger at a time, and let the thumb slide down the little finger to the base. Lastly, place your hand perpendicular to the table surface. Keep your fingers straight. Move the thumb away from the index finger to form a letter L and bring it back in. Do these 3 thumb movements for 10 repetitions and 3 to 4 times a day. It is normal to feel a pulling sensation at the wound, but do not continue with the exercises if you experience increased pain and swelling. When your wound is fully healed, start to massage your scar to soften it. This will normally be about 1 to 2 days after the stitches have been removed. Dab a little moisturiser on the scar. Use the pad of your finger or thumb to press firmly into the scar tissue and massage it in a small circular motion along the scar. Do this for about 5 minutes, 3 times a day. It is normal to have some pain when you start scar massage initially. You should massage gently at the start and gradually apply more pressure as the pain reduces. It is important for you to adopt activity modifications in daily activities to avoid awkward thumb positioning or forceful gripping and pinching, which in turn prevents the Quervain tenosynovitis. Apply the 4R principles. The first R is remove. Remove tasks that require excessive use of your thumb. Avoid carrying heavy groceries. Order them online or get someone to help carry them if possible. Secondly, replace the equipment, tool, or method of performing certain tasks. For example, use a robot vacuum or spin mop instead of your hands to wring the mop. Thirdly, reduce the frequency, duration, exertion, or use of thumb and wrist in awkward positions. For example, use a build-up handle which allows your thumb to apply less force when writing. The last R is rest by taking regular breaks in between tasks or breaking up a task into different parts. Speak with your occupational therapist to identify your specific risk factors and learn activity modification tips. You may also click on the video link in the description box to learn more about how you can change the way you perform daily tasks with your thumb and wrist. We hope this video has been useful to you. To find out more about the Quervain tendon release post-surgery care, do talk to your healthcare provider or visit the NUH website in the link below. Thank you and bye!